Science and health communications are sort of related but also separate fields of work and of study. I would say science communication is a really broad field. It can be anything from working in, say, media and news services, to working with charities, to working, as I do, in a university, helping people communicate their research to other audiences. Whereas health communications focuses a lot on working with primary health providers and drug discovery and pharmaceutical companies, and helping them communicate to their stakeholders, such as GPs, such as patients, such as board members, about the work that they are doing. So in essence, it is always about taking complicated, complex, really advanced scientific data or information and making it accessible for different audiences. But what those audiences might be and what that data might be can really vary from one to the other.
This course helps in teaching you how to sort of marry the two worlds of sort of design and science together. It provides you with a great base of sort of science knowledge, like a basic understanding of certain diseases. So if you weren't part of like a scientific background, you would know what you're looking at when you were given papers to then communicate. I'd say they provide you with great examples, and they've also brought in a lot of specialists on the subject from AMICULUM who help run this course to give their own insight into how they became sort of medical writers and then up and up the company, and sort of their experience and examples of their work, which really sort of helps.
One of the benefits of this course is that it gives you a really thorough grounding in some really key skills, and those skills are about interpreting and understanding data, about being able to be critically assessing and thinking about things, but also in communicating that in a variety of ways. So we talk about different ways of communicating, from writing to graphics to online to in-person, and so I think all of those skills are going to be all the more important in today's landscape, because we are facing both an unprecedented boom in technology and science research, but also misinformation on a really vast scale. So I think the skills of being able to critically assess data, communicate clearly, and be compelling in what you're trying to say is only going to be more important as we go out into the next quarter century and seeing what that might bring.
On the course, we covered a lot of clinical trials, how they're run, a lot of the ethics and the paperwork that go into them, and a lot of the considerations. And it's been very interesting learning about these. Obviously, you hear about clinical trials a lot when you're learning about sort of science and medicine, but having a proper understanding of how they run and what's involved was very interesting. I enjoy the process of researching complex topics, then translating them so that not sort of the lay public or different audiences can understand it. You can't really say you understand something unless you can explain it simply.